During the Cold War, the CIA created something called Operation Mockingbird. This is where the CIA colluded and worked with journalists across all media to influence public perception. Are the journalists and scientists that you're about to see part of a modern-day version of Operation Mockingbird? You be the judge.
Breaking news this morning, a new study shows, and this is an expansive study, that the anti-malaria drug that the president touted repeatedly.
This is a very, very large study.
The largest study to date of its kind.
Very large study.
The size of this study.
It was a massive study.
This is a very, very large study.
Much larger.
Much larger than previous studies.
It's a huge development. Huge.
Large study published by The Lancet.
In The Lancet, which is a very influential medical journal.
Published in The Lancet.
It's one of our clearest studies.
This is a really powerful study.
It's large but shows real danger here.
Increased risk of death.
Increased risk of dying.
So this is a dangerous drug.
It was dangerous.
That hydroxychloroquine does more bad than good.
It hurts.
We're more likely to die.
This is no cure.
There is harm.
Probably dangerous.
Let's bring in Dr. Suppan Desai. He is one of the lead researchers of the study.
And I think before we start making claims on medications that work or don't work, let science do its job. Let data drive this discussion. This study involves 671 hospitals.
671 hospitals.
600 hospitals over 6 continents.
Nearly 700 hospitals.
Tens of thousands of people.
96,000 seriously ill COVID-19 patients.
96,000 patients.
Almost 100,000 patients.
It is high quality evidence.
The off-label use of these medications in hospitalized patients with COVID should immediately stop.
Is there any data that suggests that taking it before you're sick will keep you from getting sick?
Not yet.
Seems to debunk a lot of the miracle cure claim that's been peddled by President Trump.
The president has been reckless in his promotion of this drug.
The president has promoted the drug.
Touted by and taken by President Trump.
Nancy Pelosi was bringing up that if you have a pre-existing condition, and she was saying that the president fell into that range with his heart and his weight.
This is in line with this Trump doctrine.
But the president does not know what he's talking about when it comes to science.
He is definitely not a doctor.
He should probably acknowledge that he was wrong.
Why not take it? Because you might die. How many people listened to him and how many people took it?
He also claimed political bias.
He's been taking it.
Why is he taking it?
And the president ought to stop taking it too.
Well, he stopped taking it yesterday.
A risk to prescribe this to the sitting president?
Absolutely.
Chloroquine and hydroxychloroquine both are associated with a higher risk of dangerous heart arrhythmias and an increased chance of death.
Science and facts be damned.
Breaking news that we are following today, the World Health Organization has temporarily halted studying the Trump-touted drug hydroxychloroquine as a potential treatment for coronavirus, citing safety concerns. Officials made the decision after new findings linked it to a higher risk of death.
The WHO had to act, but they have to pause this one now, that it's not ethical to continue.
Unethical to continue. I think that really encapsulates what is going on here.
A paper published in The Lancet in May of 2020 that said hydroxychloroquine didn't work for COVID was retracted after the authors were unable to confirm that any of the data was accurate.
An influential article which found the drug hydroxychloroquine increased the risk of death in COVID-19 patients was retracted on Thursday.
It was all fake.